other departments to make sure that we are in alignment with the state and urging as much as we can to open up in a safe way. Now, as you know, we are in the red, which is phenomenal, as many of the urbans are having issues. We have Riverside and San Diego that were in the red and now going back to the purple. And Ventura County is in the red. And what does that mean? It means that our students are able to go to school. Means our businesses are able to open some indoors. There's a lot of procedures that we put in place with our businesses to make sure they're following the rules and regulations that are needed. But if we were to go back to purple, we'd have to go back to being outdoors. And you and I know we don't want that. So I am urging everyone, thank you for following the safe procedures for Halloween, but I'm urging you to do the same for Thanksgiving, to make sure if you're out in a social area and you think you might have been exposed, to go get tested. We have full capacity to do testing, and we need you to follow that and go get testing on our VenturaCountyRecovers.org. We have a list of test sites. We're having Barry Zimmerman here today talk more about testing, but I just urge you, I've done it multiple times to get tested. It's a simple and easy procedure, and I just ask for you to get it done. Also, with our schools opening, just empathy for our students, our parents, our staff, teachers, everyone. It takes a lot to get this going, and just really appreciate all the work and patience that you're having with doing this. I've got emails of kids with happy faces, and just the emotional benefits of going back to school is just tremendous. And so thank you to everyone for taking the precautions so that we can be in red tier and open up schools and not just have schools with waivers, but all schools have the opportunity to make the decision to open up or not. If you need to go to more information for our health guidance, we have it at the covid19.ca.gov is our state rules and regulations. We also have Dr. Levin, who will be speaking today on our public health. And then we also have VenturaCountyRecovers.org. We have frequently asked questions, our latest up-to-date public health information, business information, testing results, and so forth. So I urge you all to go there, as usual, to make sure that you are doing the things that we need you to do. I just have to say, our county is really at the table with the county. We have the executive committee that I'm on for the California State Associations. I also last week had meetings with all the urban counties. We're in an urban counties of California where I'm chair, and we're urging everyone to really take the precautions to not spread the COVID-19 so that we can help you to move forward and go into this new normal. But to be able to do our job and advocate to the state level, we need to reassure that they understand our community is really following the rules and regulations. And so with the health equity measures, the getting the tested, making sure we have our surge protectors. Sorry, my daughter's college application is coming through right now. There's a lot of moving parts in our community, and I just want to say thank you very much for following up. Today's press conference, hold on one second, is Dr. Levin with our Ventura County Public Health Officer, and then Barry Zimmerman, Chief Deputy Director of Ventura County Health Care Agency, and Mike Powers, our CEO. And he'll be wrapping that up for you. As always, life is still continuing after the election. We know that the results will not be in today. They're saying a week, and they have to verify for 30 days. So I ask all of you for the patience and guidance to make sure we still continue to be safe for COVID and be kind to everyone. So thank you so much. Dr. Levin, if you could. Let me wipe this down first. Hold on. Thank you.
Thank you, Chair Long. Good luck on that college application. Good afternoon, everyone. I want to begin by mentioning that our statistics, our most recent statistics from today, and that is that we've diagnosed 112 new COVID cases. This was out of 1,691 tests that were done. So that's a lot of tests. It's not surprising. We found a few more cases. We had no additional deaths. We are at 167 deaths from COVID. Now, again, keep in mind that our worst flu season in the last 25 years, we had 49 deaths. So we're at 167 from this, and that is with all of the actions that we've taken to protect people. We have a positivity rate of 2.4%. That is one of the health equity metrics. And what that means is when you test 100 people, between 2 and 3, in this case 2.4%, will be positive. When we look at the lowest quartile of our county, and that includes low-income minorities and essential workers who have been disproportionately impacted by this virus, we are at 2.9%. We started out with quite a spread between those two numbers, and over the weeks, with a lot of aggressive programming, we have seen a significant decrease and really an almost coming together. And I think that's what we're looking for, is to make sure all of the quartiles are functioning at the same level in our county. We're doing a really good job at that. Our daily case rate has gone from 5.2 to 5.9 today, or this week, and that means per 100,000 population, and we've got 850,000 people in our county, for 100,000 population, that's 5.9 per 100,000. We have testing rate, as I mentioned, at 2.4%. And let me go on from the statistics to just talk to you a little bit about what my most recent thinking is about this COVID pandemic that we're seeing. No matter what your beliefs are about COVID, I think we can all agree that the importance of keeping businesses open and the option for in-person education for our kids. When business is open safely, people are earning a livelihood, their spirits are improved, the economy flows with much needed cash, people can better afford health care, and food is better and more available. Fewer people are hungry and fewer people are homeless. People can save for their futures. All of these things are public health. In-person education is just plain better than distance learning. Sure, it frees up parents to return to work. That's definitely beneficial, but kids learn more. Children who are struggling in school, our English learners, have special needs, all receive more and better attention, as do all the mainstream children attending classes. The kids learn not only reading and writing and arithmetic, but about socializing, cooperating, and sharing. So no matter what side of the issue you're on, you care about our children and you care about our businesses. The issue, of course, is COVID. We're seeing COVID cases go up around the world. You've heard that a number of European nations are seeing surges. England is now concerned about her rising numbers. The Prime Minister there said he would never lock his country down again, but that's exactly what he's had to do. We're seeing increasing numbers of COVID cases in 41 of our states here in the United States. On a call last night, I heard health officers from many counties say, we're going back a tier. One of them reminded me of Bill Clinton's aide, James Carville, when he said, it's the economy, stupid. And similarly, I've got to keep reminding myself, social distancing is what it's all about. The disease is transmitted person to person. It's as simple as that. Don't get COVID and don't give COVID personal responsibility. The most common place where we in Ventura County are getting COVID is at family and social gatherings. If you see a large gathering that concerns you, go online to Ventura County Recovers.org to find non-emergency numbers where you can call in your concern. These numbers are not for the small gatherings at your neighbors. I don't honestly know how to formalize an approach to those except to say that every little transgression to our social distancing standards, while important, is not a matter for law enforcement to deal with. Where you think that you can make a difference by intervening in a friendly, creative, or caring way, please do so. But at the first sign of any friction, just apologize and back out. These things are not worth fighting over. But for the large gatherings, where many people are putting themselves at risk, you can reach law enforcement by going online at Ventura County Recovers and find appropriate phone numbers. We've got Thanksgiving and Christmas coming up, and they're potentially large gatherings. I don't want to move back a tier. I don't want to see the impact that will have on our already suffering businesses. I don't want to see the psychological impact that will have on all of us. Moving back is not inevitable. Counties all around us could experience surges in their COVID numbers, while we could stay flat or even go down in ours. You as a county have done a great job keeping our numbers low, but your success can lead to our letting our guard down. Are we seeing our numbers going up? There's only one small indicator that that's the case, and that's our case rate is increased from 5.2 to 5.9. To keep it from going up any further, all it takes is personal responsibility. Now is not the time to relax. This is a marathon. It's not a sprint. And I've got a plan. I propose this for Thanksgiving and Christmas, but it should also apply whenever you get together with others. You know that the state has approved up to 3 households gathering together. These should be the same 3 households over time. The gatherings should still maintain 6 feet of distance between members of different households there, wearing masks, outdoors if at all possible, and any food served in a safe manner by one person. And that should be the limit. That should be the limit to your holiday gatherings. You know we have ample testing here in our county. It's free testing. But did you know that we're only using 7% of our capacity? My simple plan is this. Get tested 3 or 4 days before you have your household gatherings. Have everyone coming to your gathering be tested. That adds one more layer of security onto not getting COVID or giving COVID. Get tested. A word about testing more people, more frequently, lowering your threshold for testing. San Francisco has the same exact population as Ventura County. San Francisco is in the most favorable tier, the yellow tier. They're as open a county as is allowed to be during this pandemic. They have as culturally mixed a county as we do, maybe more. They think of Chinatown and the Mission District. What are they doing that we're not doing? They're getting tested. They have astronomical testing levels. They know when they do and when they don't have COVID. So get tested. Personal responsibility. Social distancing. Wear a mask. Keep our kids in school and keep our businesses open. Thank you very much. Now I'd like to introduce Barry Zimmerman, who is the Chief Deputy Director of our healthcare agency, and I will clean this up for him.
Thank you, Dr. Levin, and good afternoon. I'm here to communicate a few items about testing and some of the activities around testing. First of all, to add on to Dr. Levin's comments, why should we be tested? First of all, it helps us open the economy and allow us to have broader access to businesses, and helps prevent the spread of the disease by identifying and allowing us to isolate and take personal responsibility if we identify we have the virus. So where can you get tested? The county and the state have set up several sites that have been well communicated throughout the community, but primarily at the fairgrounds, Oxnard College, Moore Park College, and in Santa Paula in the parking lot behind the Oil Museum are our primary high volume locations in which you can go and receive a test at no charge. Every site is set up so you can enter in quickly, and your results will then be electronically communicated to you on average within a day. The Oxnard and Santa Paula locations are opened over the weekend, so if you're unable to access testing during the weekday, you may go to those locations and receive testing. All test sites are open from 10 a.m. to 7 p.m. to allow maximum access. In addition to those 4 county sites, the state, in partnership with us, is running 2 sites, one at the Newberry Park Library and the other one at the Oxnard Performing Arts Center. Now, who should be tested is a question that is often asked. Well, we have testing capacity to allow anyone who desires to receive a test to get a test. More specifically, anyone who has flu-like conditions or who has been directly exposed with close contact to someone who's tested positive, you should go and get tested. In addition, those who are in high-risk environments, such as working in retail, having environments where you work closely with others, or having frequent contact with multiple individuals or the public, even though you may not have symptoms, you should get tested since you are in a high-risk environment. In addition, anyone who needs to be tested for employment reasons or traveling to locations, or for those individuals who may be traveling within our county, may avail themselves of these testing locations and receive a test. All tests are free of charge and are open to Ventura County residents or those who travel or work within the county. For specific information and additional understanding of the testing locations, you can go to the website VenturaCountyRecovers.org. It is important that if you want to receive a test, that you can access that at one of our locations. It's important for the future to allow us to open more businesses, to maintain and to have a high volume of individuals receive tests in order for us to open up the economy. So I encourage you to take access and get tested if you desire to do so. I will now turn the time over to Mr. Powers, the CEO of the county.
Good afternoon. And thank you, Barry. I think it's all been very well said, but I'd just say, Ventura County, thank you to our community. Your compliance is helping our numbers stay head in a good direction. And today's theme does seem to be about testing, right? And so that's good. A couple of comments. Dr. Levin mentioning that right now we're only using 7% of our capacity. So that tells you we have lots of capacity out there, much more than most counties. The other thing I'd say is it's gotten easier in multiple ways. One, really no wait times. Two, the results come back much more quickly. And three, the experience itself is not as uncomfortable. I think I personally was tested, as many were several months ago. It was a little uncomfortable. But now the way it's done, it's self-administered, it's very easy, it's quick, and it's just a much better experience, and you always feel a little bit relieved afterwards. So I just really encourage folks to get tested at all these different locations that have been mentioned. And remember, it's free. And anyone in our county, any resident can be tested at any time for any reason. So as Barry said, it helps our public health measures, but it also helps reopen our economy. Also wanted to just touch on the health equity metric that Dr. Levin spoke to. And our number at 2.9% is a great tribute to our community and the county and our community partners' efforts to do outreach in hard-to-reach communities, low-income, high-density areas. And I just want you to know, even though that number is good, we're not resting on our laurels. We're redoubling our efforts actually in those areas to do further outreach and pop-up focused targeted testing in those communities, because it's the right thing. We want to have equity across our county, but it also helps our ability to continue to reopen businesses in our economy. And I also want to just touch on advocacy. And with the state, that happens almost on a daily basis. Frankly, it is on a daily basis, on behalf of our community, on behalf of our businesses and our schools here in our county. And it is making a difference. Some people might say, well, you're doing that, doesn't really matter. I can just tell you, first of all, in the equity metric, it made a big difference. The state hit the pause button. They worked with counties. They partnered. They came up with a much more fair and reasonable approach. The approach they had would have been harmful to a county like ours, who's been prioritizing this from the beginning. So to their credit, they listened. They also listened to our county on an individual basis and helped expedite our transition into the red tier. So it has made a difference. It doesn't mean it's easy, but it has made a difference. Partnering with other counties, as you heard Chair Long mention, is also important. So in addition to partnering with the State Association of Counties, we all are part of an urban county caucus group. This is 14 counties, and Ventura County is one of them, a small urban, that represent 80% of the population in the state. And we have different needs and challenges than, say, some of the other smaller counties in our state. And so we are combining our voices so that we make sure that we are heard with our partners at the state on these issues. So I think that's very effective. And I have the privilege also of serving on two work groups with Association of Counties and the Governor's Office. And so I can tell you that we are laser focused on these efforts. We're listening to Dr. Gawley. The state, as I say, has listened and partnered with us. One of the things that he said is really that he's focused on transmission. So we're saying, great, okay, let's focus on transmission. One of the key measures we think, and the state had thought before, was hospital census. Not just capacity, but the census. What is the numbers? And right now, I can tell you, in our county and in many counties, fortunately, the hospital census is way down. We haven't seen numbers like this since March. And so we think, even though it's lagging, it is a meaningful metric and should be factored into looking at our ability to move forward safely in our county. Also, looking at the metric of the testing requirement. Right now, when they do the adjustment factor, which we do get because we have a high testing volume for our case rate, they're using a floating average of 220 to 240 per 100,000. But the state's own benchmark is 150. And we think that they should use that benchmark because from a public health standpoint, it doesn't matter to our county if counties in Northern California are testing at a high rate. That shouldn't matter to us here from a public health standpoint or from an economic standpoint, particularly when you look at the fact that our local businesses here, based on the state's number, are complying at an extraordinary rate of 99.9%. That's the state's number. So we are continuing to advocate for that. We also looked at some more technical numbers of community transmission, like the R effective rate or the doubling rate, which are also very favorable. So we're really trying to listen to what Dr. Gawley is saying and say, even with those priorities, we think there's additional measures that the state should consider in evaluating counties' ability to move forward and reopen safely. And the last point that we continue to make to them is we look at our tracing data. Where is this? What's causing the spread? And in our county, like in many others, it's mostly private gatherings. It's not coming from the businesses. And yet when you look at the health orders, so much of that is directed and felt by and impacted on our local businesses. And we feel like there's a real disconnect there. There's sort of a lack of fairness and equity to these businesses. So we just want our businesses in our community to know we are making these points. We're going to continue to make these points. And I think when we combine our voices, it will be even more effective. So we'll keep you posted on those efforts. And the last thing I'd say, just with the election, just really to thank our community. This is one of the largest turnouts we've had in decades. But the community was incredibly responsible. Our election staff and leadership, our poll workers, our volunteers, everybody just came together, and it was Ventura County once again doing it right. So thank you for all you're doing to keep our county safe, and take care. Thank you.